Hi, I'm Lori Mattson, President and CEO of the Tri-City Regional Chamber. Welcome. If you're just now joining us for the third annual Tri-Cities Diversity Summit, or if you're rejoining us after the last listening session which just wrapped up, we're glad you're here. Much thought and planning have gone into this three-day summit, which features 5 listening sessions intended to create open, meaningful dialogue about issues that affect business and residents in our region. Before we begin, allow me to thank Battelle, the premier sponsor of the Diversity Summit. We greatly appreciate their partnership during the past 3 years as sponsor of this impactful event. Next, I'd like to introduce Ashley Hissam, HR Administrator with HPM Corporation, one of our silver sponsors, to say a few words.
Hi, I'm Ashley Hissam from HPM Corporation. HPM Corporation is going on its 9th year as the prime contractor of the Hanford Occupational Medical Services Clinic in Richland. At HPM Corporation, people are the key to our success. We produce our best results for clients in the company when people from different backgrounds and walks of life come together to generate new ideas and new solutions. We encourage this outcome by supporting our people as individuals and encouraging them to bring their unique perspectives and life experiences to work every day. We are so proud of our diverse workforce, and we believe that by promoting our employees, our business partners, and ourselves to live, learn, and embrace our culture of diversity and inclusion, that we will continue to see a positive change. It takes a very thoughtful approach for inclusion to be successful. Our transparency paired with individual accountability is the key to building a culture and community where diversity, inclusion, and equity can thrive. On behalf of HPM Corporation, we encourage everyone to spend a little time each day asking yourself, what can you do to be part of the change? We are so grateful to the Chamber to provide us this platform to talk about the importance of diversity and inclusion.
Thank you, Ashley. Let's welcome our session moderator, Shannon Fitzgerald, and her panelists who will discuss pathways for all residents to have equal access to economic opportunity. Chauné is the founder of Women of Wisdom Tri-Cities and a local business owner of Salon Remedy in Richland. She's a member of the My Tri 2030 Inclusion Council, whose members help to coordinate this event. Welcome, Chauné.
Thank you, Lori. Hello, panelists, and hello, audience. My name is Shannon Fitzgerald, and today we have an amazing panel on economic inequity and opportunity. Now it is with great pleasure that I will introduce to you our panelists for today. First, we have joining us is Dr. Patrick Jones. Dr. Jones is the Executive Director of Eastern Washington University's Institute for Public Policy and Economic Analysis. He is currently the chair of the City of Spokane's Mayor Advisory Council on Economic Vitality and has been inducted into the Spokane Hall of Fame. Next, we have Dr. LoAnn Ayers. Dr. Ayers is the President and CEO of United Way of Benton, Franklin County, and United Way of Benton and Franklin counties. I want to get that correct. For more than 30 years, she has had the privilege of teaching and mentoring hundreds of locals. Now we have Melvin Calloway. Mel is the Vice President of Retail Services at Gesa Credit Union. As a financial executive for 40 years, Mel engages in business strategies, member services, innovation, and to-go market products. Finally, we have Paula Sardinas. Paula currently serves as the President and CEO of FMS Global Strategies, a governmental affairs lobbying firm. Her career in public policy spans 25 years, working in telecom, engineering, banking, IT, STEM, cannabis, social equity, and financial literacy. Let's get started. So excited. Equity or economic equality is the concept or idea of fairness in economics. More specifically, it refers to the equal life chances, regardless of identity, to provide all citizens with a basic and equal minimum of income, goods, and services. On this segment, we will discuss disparities in income, the wealth gap between the rich and the poor, the lack of fairness and justice, and how that measures in our society, and more importantly, in our community. We will unfold the beliefs that most Americans have when it comes to meritocracy, meaning that people advance in wealth and status through hard work, not privilege. But inequality of unequal opportunity can limit upward mobility. We all know that this is not a new topic to America. The have and the have nots, the rich and the poor. But what we want to do today is differentiate between the two words of inequity and inequality. So Mel Calloway, we're going to start with you on this question. I would like for you.
Go ahead.
All right. How are you today?
I'm doing fine, and thank you for the opportunity, and also thank you to the Tri-Cities Chambers for this opportunity to come and share some information this morning.
Well,
Look
glad
forward
to have
it.
you. Exciting. Can you give us your perspective on these two words and tell us, is it true? Is it based on one's merit alone to be a success? And can you describe how inequity and inequality works and share some insight on the state of the economic inequality in this community? Mel.
Um, First of all, we have to get clear meanings on equity and equality, and inequity and inequality, because there is a big difference in the two, and a lot of times those two get interwoven. And I'll start out first talking about what equity is, and then I'll talk about what inequity is, and then I'll talk about equality and what inequality is. And I'll give you some examples of those to make it more clear to everyone. First of all, equity at its most basic level is based on an individual or group's need. And inequity on its most basic level means that people's needs are not being met. I mean, this can be concrete things like lack of food, shelter, lack of clothing, and it also can be racial, institutional, and structural conditions that have created barriers which lead to a lack of access to opportunities such as internships, jobs, job promotions, scholarships, post-secondary education, or affordable housing and loans, and even reliable transportation. So when we look at equity, we have to look at the other side of equity, which is equality. Equality at its most basic level is sameness. I mean, which some people are more comfortable in saying is fairness. And you find this to be a culturally subjective word. I mean, inequality at its most basic level means everyone didn't get the same thing. Equality creates a condition of everyone getting the same thing regardless of their actual needs. So you have to understand that, while you might say is total equity, you also have to look at people have different needs, and they're at different points in their life, as well as communities or have different needs, and they have different levels of income and everything else that impacts what's going on in that particular community. We have a fixation on this country on, sameness equals fairness equals equality. This will only be true, if the conditions continue to cause inequality and therefore equities, and these have to be eliminated in order to have a level playing field. And we do, as I said before, we have some structural, we have some institutional systems in place that does not make it a level playing field. And those are things that we have to look at and really focus on. As I said earlier, I'll give you just a quick example of equity and equality. And here's an example. You have a generous, good-hearted person who wants to make a donation, say, of cleats to every member of a football team at a high poverty high school. Or when when the cleats arrive, they're all size 12. Now, while these will fit some of the players, they won't fit all of them. The situation of providing the same, which is equality, thing to everyone didn't meet their need, which was the equity. It also created an unfair or inequality condition or outcome by providing resources to some players at advantage and then some other players, it was an inequity. Good intention, negative impact for some. And this is what we see happening on a daily basis within the city and within the country. And I'll give you another simple example that will resonate with all of us. How many of you have more than one child? I mean, if you have more than one child, do you treat them all the same? And the answer is probably not. And of course they don't. And I tell you that an example of this is practicing equity. They know the child, they know they have a relationship with the child, but they know that they have different needs. So you want to make a clear distinction on that, and before you can really get into looking at how do you make it a fair playing field, understanding what equity is, understanding what inequity is not, and understanding what equality is and what inequality is not. So those are just some of the basic definitions I want to go through that. But there is a stark racial inequality of personal finances in America. And inequities that you look at, and they have without financial stability, it has impact on health, it has impact on home ownership, it has impact on less education, and it has impact on kids, and a lot of kids start out that way. But when we look at 4 to 5 main things that the inequities really impact, one is household income. The disparity in incomes between white America and minorities families. The graduation gap in college. How many minorities actually graduate and how many don't graduate, and how many can't afford to go to college. You have minorities that have more student loan debt and more default. And this is kind of a chain reaction. If you don't own your home, and you don't have equity in your home, or you don't have investments, then you have to get a student loan. So a lot more have to go and get the student loans, and a lot more default on them. Now, when that starts to happening, is now you have your credit score is lower, and when you apply for a loan, you probably won't qualify. You have kind of a dual effect happening here. You do get the student loan, you can't pay it back, it impacts your credit. And then the other thing that happens is that when you do go to get a loan for your home, you cannot get that loan, or you got to get it at a higher interest rate than others do. And then the biggest thing is the home ownership gap that we have in this country, and the gap is widening. I mean, when we look at the home ownership gap, it's the widest it's been in 50 years. I mean, and the home is the largest asset for any and many American families, which help build wealth over time. And the home ownership gives you generational wealth. If you can't have that kind of wealth to pass on from generation to generation, it's hard to get started with a lot of this. And when we look at what's going on is that white families have nearly 10 times the net worth of black families, and the gap is growing. Despite gains in economic wealth, the economic chasm between black and Hispanic families and white counterparts has even widened. The median net worth of whites nearly 10 times the size of blacks, and nearly 1 in 5 black families have 0 or negative net worth, twice the rate of white families. And when we look at Tri-Cities and we look at home ownership, you have to go back really as it relates to African Americans and as it relates to Hispanics, you would have to go back to the Hanford Project. I mean, and that was in 1943, 1945, when DuPont started bringing African Americans from the South to come work at Hanford. And, at one point they had approximately 15,000 African Americans that was working at the Hanford location. And, what happened from that is that, they also had a situation where they could not provide housing for all those African Americans. So most of them had to live in Pasco, and most of them they built one barrack and one shelter for 15,000 African Americans. So they had to live in tents, they lived in shacks, and they lived in trailers. and it was very, very difficult to get a foothold on home or getting credit in that situation, you know. And, you know, the African Americans faced discrimination from businesses in Pasco at the time, you know. If you didn't have home ownership, you couldn't own a business, and it made it very hard for you to, you know, have any kind of political clout or to get a foothold in anything. So, you know, and then there was some, you know, some you know, federal laws and some policies that also impacted a lot of that, you know, and I'll go through them real quickly. And, you know, in 1934 through 1968, you had the FHA underwriting manual, and that was redlining. I mean, it was denying goods and services to racially determined neighborhoods to exclude minority populations from, you know, accessing loans or businesses or mortgages, you know. And then they had the GI Bill. You know, minorities that had fought in the war, they returned, and their white counterparts, you know, they were getting loans to get homes, to get businesses, and to get started. Well, the African American and minorities, they were denied that opportunity. You would think, you know, fighting in the war and that you would have the same thing. This is where you have the inequities that's taking place. You know, in 1950s and 60s, you had the Eisenhower federal highway system, you know. And, you know, most of the highways were, you know, when they started talking about city expansion, they came through the poor neighborhoods. You know, they built, and you got that in the Seattle area where they built Interstate 5. And it disrupted a lot of those communities where they did have ownership, and African Americans were doing well. But now you build a interstate in between my community to make it easier for people to get to the other side. I mean, so we got a lot of those inequities and inequality that we really got to work through, and we really need to make sure that you know, we are addressing. And it's not about fairness; it's about you know, taking away some of these institutional barriers that have been in place for so long. So,
wow.
Yeah.
Thank you, Mel. Did you have anything else you want to share on that? Because it sounds like to me that it's time for economic equity to meet human equality.
And that's exactly what has to happen. But a lot of people misunderstand that as just being fair. They're saying, well, you know, you got an opportunity to get a home, you have an opportunity to get an education. But what they don't show you, or what they don't understand, is that there are some barriers that are in place that have prevented that from happening.
There are many ways to measure income inequality, and expert economists continue to debate which metrics are the best. And based on what you just shared, Mel, we're going to take a lot of what you said in consideration with this next information that we're about to receive. So we're going to turn it over to Dr. Jones. And Dr. Jones, is there any validated measures or data related to inequality that we can be steered towards? And just give us some directions on where we are, where do we stand today in this whole inequity and inequality, and how does that measure up?
I think there's several measures. There's not one overarching measure, and I'm going to present just a few of those measures that look at race and ethnicity and the differences between the different groups in the two-county area. There might be a way to try to collapse all this into one overall measure. I just haven't done it, and I just don't know who's doing that. But I think these will give some insights into, to some degree, what Mel was just talking about in the Tri-Cities. So if that's okay, Chauné, I'd just like to go through these slides ever so quickly.
Absolutely, Dr. Jones. So
next slide, please. So I'm going to be talking on the basis of what we measure in Benton Franklin Trends, which for those of you who haven't been on that website, it's a big portal into all aspects of life, or most aspects of life in the Tri-Cities, the greater Tri-Cities. And we track it over time, and we track the measure also against the state of Washington and the United States. What you'll find when you go onto the site is that most of the trends really don't have the opportunity to present the trend by race and ethnicity. And I've taken a deeper dive today, sort of outside of the trends, to try to provide some of that detail that I think is important. And I think, to nobody's surprise when you're going to see this, there's lots of differences. So why don't we go on to the next slide? And this is just a screenshot of the homepage of Franklin Trends with the beautiful bridge going over the Columbia. And I invite all of you to check it out. There's no cost to doing so. We keep it very current, and we're just in the process of updating that as we speak. So next slide, please. Now, I think it's important to define our terms about diversity, at least from a data point of view, in the Tri-Cities. And this image, unfortunately, is a little tight for most of you on the screen to see, but what we have here is the race and ethnic breakdown that is non-white for the 2 counties, and that's in shades of blue, for the state of Washington, and then in green, and then for the United States in black and gray. And you can just eyeball, perhaps just shift your attention to those last 3 bars on the right-hand side, and you can easily see that the sum of the columns, the parts of that column in the blue, that's 2019, by the way, for the Tri-State Benton and Franklin County, are considerably above that of the state of Washington. So a takeaway real quickly is here that at over 40%, or close to 40%, the race and ethnic diversity of the Tri-Cities is greater than it is statewide. And you can also look by just going a little further to the right and look at that black column and see that it's about equal to the United States. So in that sense, we have a fairly representative segment of the population that is non-white. The difference is that in the composition, and most of the non-Caucasian white, non-Caucasian folks in the greater Tri-Cities are Latinx or Hispanic. Next slide, please. So I picked 3 indicators, or 4 indicators actually, to look at that show disparities. And the first is median household income, which is a measure of, I think, one of the best measures of income, and certainly a precursor or something that is necessary if we want to accumulate wealth. And so there's 3 lines here. The top line is the state of Washington in green. The bottom line is the United States, and the middle line is the Tri-Cities, or the Benton and Franklin counties. And you can see that Benton and Franklin counties actually is above the median for the United States. And that has a variety of reasons, which I won't go into here. But in 2019, the estimate was a little over $68,000 in household median income. And again, the median measures the middle, not the ends, and either low or top. And we'll look into one of the ends here shortly. Next slide, please. Now we're taking that same median household income right now and breaking it down into race and ethnicity. We can't do it just for 1 year due to the small sample size of many of the groups. So we've combined 5 years worth of estimate, or basically I haven't, but census has. This comes from census, and we have an estimate which is indicated by the diamond, and then we have a range of outcomes. And in some cases, there's very little range of outcomes, and in other cases where the population of this group is quite small, it could go either way beyond what you see as that diamond estimate. But I just want to point out a couple things. The middle diamond, which is all for those last 5 years, has been about 59,000. Now look at what's on the left-hand side of that middle diamond, and you see white alone and Asian, roughly a little over 80,000. And then you look at what's on the right, to the right of that particular diamond, which is again the middle, and you have Native Americans followed by the Latinx population. So right there, you can see there's a 1/3 difference between the overall median and what we see in whites and Asians, and similarly a minus 1/3 difference from the overall rate to African Americans and Latinx folks. And then, of course, the span between, say, white alones and the Hispanic population is quite large. That's $40,000. So imagine if these households had another $40,000, how well off they'd feel. Okay, let's shove on then to the next slide on this, Austin. So this is just looking at the same information and putting a dotted line through 100% and saying, what groups are over 100% and what groups are under 100%. And you can easily see there what you saw before, that the Asian and white alones are basically over, and the Blacks, Latinx, and Native Americans are below. But what I do want to point out here in the in the orange bars, you see what's happened between the first 5 years of the last decade, 2009 through 2013, and then the last 5 years of the past decade. And you can see that for African Americans, for the Hispanic population, and the Native Americans, that the orange bars are higher than the blue bars, which means there has been some growth. So I just want to keep that in mind as we go through an assessment of what's going on in the greater Tri-Cities. Next slide, please. So poverty rate really refers to not that middle value, but what's at the lower to 10 to 20% value. You can't see this very well, but the blue line at times has been above the rate of the United States and certainly above the rate of the state of Washington. And most currently, it was 13% in 2019. That hasn't really budged, that poverty rate, since the start of this series, which goes back to 2005. So the war on poverty, if there is such a thing in the Tri-Cities, really hasn't made a lot of headway. Next slide, please. So let's look at poverty rates then by race and ethnicity in this community. And again, we have to bunch up 5 years to get some reasonably sized samples to look at the breakdown by race and ethnicity. So the middle value there is a little bit lower, or I'm sorry, a little bit higher than what we saw before. It's 13.7%. And to the left of that middle value, which says all, you see the Black poverty rate, the Latinx poverty rate, and the two or more races poverty rate considerably higher, especially for African Americans and the Latinx populations. On the other hand, the Asian poverty rate, you can see over there, is at 7.2%. So quite a bit of disparity in this important measure of income distribution. Next slide, please. So this is looking at, again, the change over time by the poverty rate. And you can see that for the first 5 years are in blue, the second 5 years of the past decade are in orange. And you can see that in most cases, but not all cases, they have dropped. The increase in the Black poverty rate, I would argue, is statistically a wash. But you see a dramatic drop in the poverty rate for the Latino population, for the Native American population, and then for the Asian population. Okay, so that's it for income. Let's go on to the next couple slides. And I want to wrap up here. The key to getting these numbers higher for the entire population, and certainly the racial and ethnic groups in the Tri-Cities, is education. And this goes back to what Chauné was talking about, a meritocracy. If we do our homework, hopefully we'll be rewarded, right, from the teacher and from our degrees. So this is looking at those that have a BA or higher. You can do this for those that have a community college degree or higher, but that was a little more complicated. So I just stuck with this. And of course, those with the BA or higher are the ones that are going to command the highest wages and salaries, and therefore incomes in any economy, and certainly the one in the Tri-Cities. So I don't have a middle value here, but I'll just say that it's been around, I think 2019 showed that it was in the low 20% for the overall rate, those with a BA or higher. But here, look at the difference between the Asian Americans at 47% and then the Latinx population at 8%. So there is much more room to be made up here in terms of having these diamonds become a little more concentrated around a line, say maybe 30% or something.
Yeah.
You can just follow the sort of the downward trend, starting with Asians going down to the Latin population. Okay, next slide, please. So to get a degree, whether it's a BA or higher, or whether it's a certificate, or whether it's a AA, you got to finish high school. And that is a challenge in many communities, and the Tri-Cities is not there's no exception here. I just looked at Kennewick because of some time constraints. The Kennewick School District, on the Trends website, we have the overall rate for all the districts in the two counties. But this is just looking at Kennewick, which is of course the largest district in the area. And you can see I've done this for the two different halves of the last decade. And unfortunately, there's been a little bit of a decline for a couple groups. The African American group, I wouldn't spend a lot of time wringing our hands about because that was a very small sample in 2019. And so my guess would be if we looked at several years in conjunction, it would be closer to the 2015 value. But you see again, Asians have the highest graduation rate, followed by whites, followed by the Latinx population. We don't have the Native American data because there were too few to be counted or where the data would be released, and then the African Americans. So this is a challenge, I think, is to try to get graduation rates overall up, and I think this slide sort of gives some ideas on where one might focus some work. And the final slide. This is looking at housing. So following up what Mel was talking about, looking at home ownership in Benton and Franklin counties for this 5-year period. And we're comparing the share of homes owned to the share of the population. So all these bars should add up to 100%. And you see that for this period of 2014 to 2018, a little over 71% of the homes were owned by whites, and yet the white population is about 60% in the community. On the other hand, about 22%, 23% were owned by Latinx population, and about 31 to 33% on average is the population share of the Latinos in the Tri-Cities. And the other four, racial and ethnic groups are quite small. I think this gives you an idea of what we're looking at. And the disparity between ownership and population share really isn't that high, with the exception of Native Americans. So the big disparity here is the Latinx population in terms of home ownership. And I think I'll stop there and let other people react to this. And if the next slide, please. I don't know if these will be posted, but if you did want to contact us, there's my contact info, and we'd be happy to respond.
Thank you, Dr. Jones. This was very informative and very timely information. And there are some huge disparities, and I can tell by the measures that in the racial communities and the ethnicity groups, the need is there for inequity and inequality to be addressed. LoAnn, I want to go to you because you have 30 years of experience in this community and with helping those who are in need. So could you provide some examples of how these trends create barriers to our economic opportunities and what you foresee to happen here in our local communities and how we can help?
Certainly. Well, I appreciate Dr. Jones providing the data, really looking at economic opportunity and barriers, because every barrier represents opportunity. So I'm going to start with just some reflections on, so what does that mean? Particularly with Dr. Jones kind of ending his presentation and looking at access to education and educational success. I am going to just show some information briefly talking about barriers, and I think on your screen, we really look at, in order to be successful in life, one must have health first and foremost, but that is a big interrelated, there are many circumstances that create health and wellness in order for one to be successful in education, be successful in a family, be successful in a job. And so I'm really looking at the data that Dr. Jones provided, as well as my interactions with, 2 to 15 nonprofits every day who are really at the front lines of dealing with and connecting with families who are under stress, who need support. And it really is important for every tri-citizen to think about these things, because every person who is being born now is your future employee, your future customer. Every child who's in middle school, your future employee, your future customer. So we all own this. And if you look at what goes into health and life opportunity, barriers begin very early. And those barriers can affect opportunity and inequities that prevent access to opportunities. So, going to next, there we go. So if you think about housing, hunger, access to transportation, and stress in the family, mental and behavioral health, all of those aspects that create opportunities or barriers, it really this chart gives you an idea of how social and economic factors have the largest impact on your future, on your health and wellness. Health behaviors do, access to care in your physical environment, but really it's those social and economic factors that have such a significant impact. And looking at those factors, I'm going to just drill down to some local feedback. There's pre-COVID data, and there's post-COVID or current COVID experience. I always like to say that I love data, but data lags reality. So in our community, we had challenges in each of these areas and more before COVID. And in every single area, those challenges have been magnified and disproportionately magnified for certain segments of our population. For example, in hunger, 1 out of 5 kids before COVID were food insecure, didn't know where their next meal was going to come. That was before COVID. Our food banks are reporting a 50 to 70% increase in demand for food across the Bi-County area. That's from the little food bank in Connell to those larger ones in the Tri-Cities. And what they're seeing is a real uptick in 3 categories of first-timers, families, particularly with young children, persons of color, particularly our Latinx families, and seniors. That's where we're seeing the largest increase in first-timers coming to our food banks that are making up a portion of that increase in hunger. Access to healthcare has also been adversely affected. We still have almost 10,000 people who were employed in February who are not employed now. Many of those persons, adults, lost their health insurance. And so access to healthcare has been affected both by loss of health insurance, but also about the fears that we create about accessing healthcare. You've seen in the news, people are afraid to go in and get their immunizations, afraid to go in and get wellness care. And that is seen as most challenging with prenatal care. Prenatal care before COVID was a challenge among persons of color. And as you can read, Latinas are less likely than women from any other ethnic group to get prenatal care. And African American and American Indian women have a high likelihood of pregnancy-related significant health issues. And so that was pre-COVID. And during these last 6+ months, we've seen a decrease in the numbers of persons wanting to access healthcare. Mental health, though, is a significant concern, and we think we're seeing the beginning of a tsunami. This mental health affects everyone from kids in kindergarten all the way to seniors. Before COVID, Benton and Franklin counties were second highest per capita in the state of Washington in our rate of suicide ideation and completion. Second highest per capita in the state of Washington. And that mental health crisis has been affected, and it certainly affects homes where children see their parents struggling. It affects children who are isolated, who see more stress and violence within the family and in their neighborhoods. Recent data just came out that youth of more than one race have a 28% higher rate of severe major depression, and yet 60% are not receiving treatment. That's just one glimpse at the inequities that are occurring within mental health. And of course, we've been talking about education. The gap is widening. Dr. Jones talked about our graduation rate, and across the 8 school districts in Benton and Franklin counties, in the last data that was available, this is pre-COVID, of course, we had 80% of our high schoolers graduated within 5 years of starting. That was consistent with percentages across the state of Washington, but getting worse in Benton and Franklin counties than the year before. And if you rewind that, we have about 10% of our kids who drop out in 11th or 12th grade. And that data was getting worse and is significantly worse than the state of Washington. Rewind that all the way back down to kindergarten preparedness. And only 39% of our kiddos enter kindergarten ready. Only 39%, and that was pre-COVID. But if you were from a family of poverty, which has a higher connection with those persons of color, only 1 out of every 5 kiddo enters kindergarten ready. So if we rewind and we look at all of the things that take into consideration for a healthy society, I'm going to click all the way back. And in order to be successful in education, at least through the high school level, and become a self-sufficient adult, there are barriers that we all own. And so I'm excited to bring forward a couple of bright spots. We have an early learning alliance within Benton Franklin counties that is very active in looking not only at kindergarten preparedness, but equipping parents with parenting skills, looking at hunger and homelessness and all of the other elements that create a healthy condition for children to be successful. We also have a specific initiative going on related to asset building, particularly affecting persons of color within Benton and Franklin counties. You know, if you look at across our community, we have a lot of family-owned businesses that have been very successful, and they're now getting into their second or third generation and looking at succession planning. And so we're starting some work as a collective in the community to look at employee ownership. And employee ownership is one of the real keys to asset building, particularly for persons of color. Well, I'm going to pass the baton back to you, and we can continue this conversation. Thank you.
Thank you, LoAnn. It sounds like that we already had some pre-existing gaps, and the coronavirus pandemic has really highlighted a lot of these inequities in our community, especially in food, education, health, mental health, and also with the health excess. Would anybody else like to share or chime in on this topic before we move on? Okay, I think we just about got it covered, and you have given us some very good examples and information, and also some upcoming opportunities. So I'm going to be getting in touch with you to make sure that we get this information out to the community as well. When we think about where we are and where we're going to go, and how do we fix this problem, even though we know there's no overnight solution. Just recently, I was doing my own research, and I read the 10-year plan for the future, which is a draft that was put out by a group directed by Governor Inslee. It's called the PRWG, and it's the Poverty Reduction Work Group. And they developed the comprehensive plan, reducing poverty and inequality in Washington State. And I found this information to be helpful, and it can be found at dismantlepovertynwa.com. So that leads me to you, Paula. What do you think are the future challenges of the economy to reduce social inequity and provide better solutions to distribution of wealth? Do you have any government insight or that you'd like to give us today?
Well, first of all, thank you, Chauné, and thank you to the distinguished panelists. I'd like to first start by just tying all of their information together. And so between Dr. Ayers, Mr. Calloway, and Dr. Jones, they've presented almost 90 years or a century of systemic inequality. We know this inequality goes back about 401 years, right? So when we look at it and you say, what are some of the root causes and economic indicators? Well, from 1992 until 2016, the wealth disparity between white Americans, Black Americans grew tremendously. In 1992, the disparity was at $100,000. In 2016, it sat at about $154,000 with no real growth in incomes for communities of color. So that's going to impact the things that Mr. Calloway is talking about. That's going to impact housing. You can't buy a house if your income isn't growing. That's going to impact things like our generational wealth and your investments. And so how do we measure economic instabilities and inequities? Well, we look at our GDP. So we look at consumption, we look at the stock market, and we look at investments. As we watch the stock market tick up tens of thousands of points in 2020, it doesn't match the reality of COVID or pre-COVID. You see the stock market is rising for the top 1%, but those dollars are not actually trickling down. They're not creating more home ownership in communities of color. They're not creating generational wealth because a lot of those folks, for some of the very underlying factors that Dr. Ayers mentioned, they're not able to invest in the stock market. So when we talk about what is our future outcome from a state, federal, and local level, it's a three-pronged approach, and the state has to sit in the middle. So we've got to have, a post-COVID economic package. What does that mean? That means that we would have loved to have had another $1.3 or $1.7 in stimulus before the Senate recessed and went home. Because having steady employment and tackling that with strong fiscal monetary policies is how we're going to create generational wealth. What are some of those underlying factors? We know in the 40s, 50s, and 60s, Black businesses were booming and bustling. So what do we have to do? We've got to support chambers. We've got to have microloans for small business. We've got to bring ownership back to communities and have a sense of pride in that. None of that really matters if we don't tackle the educational disparity, things like digital equity. As Dr. Ayers was saying, I've been championing and working on things like universal pre-K since 1992, and I had the privilege of working with the Clinton administration. Here we are in 2020, and we're still talking about universal pre-K. We know that when you reach children at a young age and you educate them and you plant that, then they have better outcomes, better success rates, and they're more than likely to graduate from high school. So we've got to close that educational gap. As you graduate from high school, you're more likely, if you look at the data, to go on to post-secondary education. We know for a lot of people, if you don't at least have that bachelor's degree, it's going to be very difficult to get to that $60,000, $70,000, $80,000 range. There's going to continue to be a disparity. So we've got to have fiscal policies that support a strong employment underpinning. We've got to make sure that we back that out by supporting local governments and local chambers and building out those small businesses. We've got to have real policies around education and get honest about the need for universal pre-K. We've also got to bring back things like internships. In places like the Tri-Cities, trades are very important. Those are good union paying jobs. What do they also offer? They offer benefits. They offer 401ks. They offer 529s. We're talking about how you make that transition. If I don't have a job with a 401k, it doesn't matter to me that the Dow Jones is near 30,000 or that it went down yesterday by 654 points. If I'm not vested in that, I don't feel that in my family. I don't see that in my pocketbook. I'm not thinking of retirement. I'm thinking of survival. And so if we're going to really tackle those disparities, we have to look at some of the things that Dr. Ayers and Dr. Jones laid out. What are some of the root causes of this? It's like Maslow's hierarchy of needs. If I don't have food, shelter, clothing, and those things that I need to succeed, how's that mother going to get up and be able to take care of her family and make sure that child's getting a good education? They're doing homework. We know before COVID, nearly 820,000 Washingtonians fought food insecurity. A third of those were children. And she's correct. Post-COVID, we're probably closer to about 2 in 5. And it's reaching both urban areas, rural areas, and it doesn't discriminate when it comes to income. There are middle-class families who are struggling with food insecurities as we watch our businesses shrink. 95% of the businesses in Washington state are considered to be small businesses. So you think about that economic impact and the ripple that is sent through the state of Washington. So if we're going to really tackle these disparities, we have to look at them on a local level, like what works for Benton and Franklin County versus what might work for Seattle versus what might work for Vancouver. What are some of those local issues? When you see the home ownership, nearly under 3%, we've got to ask ourselves what's causing that. What are some of those economic impacts and drivers? And we've got to have really honest conversations about when we have entire populations that are 50 years later no better off, then we've got to create local policies at the local city council level, at your mayor's level, to impact your local jurisdictions. But we're also going to need some state and federal support. So when session starts in Olympia, one of the things we can do is to make sure that we're appropriating funds both to support microloans for small businesses, but also to help people like Dr. Ayers do the good work that she's doing. Before I got on this summit today, we were sending out an email that said there was $2 million available to Commerce for BIPOC or Black-led nonprofits, and that's a good start. It'd be nice if we could get those dollars up to $200 million. That means we're going to need a little help from the federal government to make sure we can get those large tranches of money, and then put those money in the local communities and let the local nonprofits, local NGOs, and those local governments best allocate those resources. So, because you guys are closer to the people, you are listening to your citizens, and so you can implement the policies that your specific jurisdiction needs to achieve that generational wealth. And I'm super excited to just be a part of the process on a statewide level.
Thank you, Paula. And yes, we do need strategies by diverse groups of stakeholders in government, for-profit, nonprofit, and philanthropic sectors for opportunities to arise for our equity to occur. We're just about near our end of this segment. However, I just want to ask one last question to our panelists. If they can share, or if you have not already done so, any strategies for opportunities, like what can be the next plan of actions or any suggestions for those who are feeling that oppression of inequity and inequality, and any direction that you can send them to for help? Anyone, any panelists?
I would say, as a commissioner with the Washington State Commission on African American Affairs, is reach out to your local community, and we can't just talk in a microcosm of people that look like us. Racism is an issue that requires allies. Equity is an issue that requires allies, which means I need to be talking to Indigenous communities. I need to be talking to my allies in white communities, Asian communities. If I see the disparity, especially in the high school numbers you guys put up, then we need to be having those conversations at your local ESD levels. You need to be having those conversations at your local parent-teacher associations, and talking about how we can have cooperative and collaborative strategies to help. We can't just stay in our silos, or what I call our color or ethnicity corners, only talking to people that share the same problems. We've got to go and talk to other people that can present some similar or different solutions if we really want to be serious about solving equity challenges.
Mel, did you have something that you wanted to share?
Just in line a little bit to what Mrs. Sardinas has said, we got to do more at the local level. And that means getting out and voting for city councilmen, voting for the judges, voting for school superintendents. We got to get this at a more local level, and we all have to get involved. A lot of times you're having these conversations. Some of these conversations I've been having for the last 40 years, and we still having them. But everybody's waiting for what are they going to do, and they need to do something about this. We are the day. To affect change, you have to get involved. You got to have the conversation. And these are not pleasant conversations. When you start talking about diversity and disparity and inequalities, these are tough conversations. But you got to have those conversations, and you got to have those conversations with people that can affect the change. And that starts a lot at the local level, and then it goes to the state level, and of course to the federal. So we all got to get involved in this. We all got ownership in this. We're trying to do a lot with financial literacy and working with the high school students. You'd be surprised how many people do not understand finances. You know, they can't fill out an application. You know, they don't know how to apply for a home. There's a lot that can be done at a local level. You know, you can do a lot in the community. You can do financial literacy programs in these communities. You can work closer with the high schools and just to make people more informed and knowledgeable.
Well, thank you so much, LoAnn. If you didn't have anything else, Dr. Jones, you all have given us some great information. Dr. Jones, is there a final word? We have about 2 minutes. Would you like to close us out with something really quick here?
I think we've covered a lot of good ideas, and I hope we've presented some facts. I do think, to follow what Mel was saying, it will take effort at the local level. I mean, that's what United Way does. I assume that's what Mel, you do in your work with and outside the credit union, and just steel ourselves for something that will take more than a year. It'll take several years, and you know, these trends don't reverse themselves easily. But I wanted to show that there has been some progress in certain areas. So we should not look at all those charts and tables with despondency or doom, because there are some activities that apparently are changing the meter.
Well, I thank you for that hope, and thank you for sharing those measures that we can reflect back on. And I just want to thank you for your participation today. Thank you to our audience, and thank you to our sponsors as well as our summit chairs. Our time is up here, and I just want to welcome back Lori Matson.
Thank you. Thank you so much, Chauné and Dr. Jones, Dr. Ayers, Paula, and Mel, for the great discussion and for sharing your expertise and experience. We really appreciate your contributions to this conversation today. As a reminder, the Tri-Cities Diversity Summit continues tomorrow at 10:30 a.m. with the final listening session titled DEI Starts in the C-Suite. We have local CEOs. This will be followed by the presentation of the Tri-Cities Champion of Diversity Awards and a keynote presentation at noon from Scott Welch, Global Diversity and Inclusion Strategist. His keynote is titled Change and the Culturally Competent Leader. There's still time to register at tricityregionalchamber.com. And as a reminder, all sessions from the Diversity Summit will be posted to the Chamber's YouTube channel and on our website, tricityregionalchamber.com. Thank you for joining us today. We hope that we'll see you tomorrow.